What would you do if you're working with this patient or an athlete that's returning to play with a situation like this? So let's say we have a patient or athlete that's recovering from a catastrophic knee injury, or they might just be having just run-of-the-mill patellofemoral syndrome. They have pain with squatting, so when he squats, he has anterior knee pain at about 90 degrees. So here are your choices. You can either tell him, well, only do a quarter squat because then we're not going to where the pain is, or we could decrease the load. So let's say he was holding 50 pounds to begin with, we could go down to 25 pounds. Or we could say, well, let's just not squat because squats are probably bad for your knees anyway. So here's what I would do. I would definitely not limit his range of motion. So remember, MoStreBility stands for motion, strength, and stability. So getting rid of motion or keeping him out of specific motion only avoids the problem. It doesn't attack the root cause of the problem. We could decrease the weight, which would make sense. But remember, we also sometimes will decrease pain by increasing the weight because it causes more facilitation throughout all the muscles that are supposed to be working. What about just saying, let's not squat? Well, that doesn't do anything but run away from the problem. So what we should be doing is assessing his quads, hams, glutes, dorsiflexors, plantar flexors for neuromuscular function, and then assessing his squat and probably increasing the amount of resistance, but never limiting range of motion and never getting rid of the exercise.